I am T. Douglas, columnist for Blaque magazine. So, on January 28th, Trump he issued an executive order addressing provisions on health care for transgender individuals in the United States. And this order, it does include several false claims, of course, about gender affirming care. The executive order also mandates federal agencies to take actions that's going to limit access to gender affirming care, such as removing coverage for gender affirming care from federal health insurance plans. It's talking about changing requirements under the Affordable Care Act to limit access. It also talks about preventing hospitals and other medical providers who accept Medicare, Medicaid, or receive federal funding for research or education from providing gender affirming care to individuals under the age of 19 years old. So, first thing I'm going to say is you have to remember that executive orders do not have the authority to override the United States Constitution. They don't have the authority to override federal laws or to override established legal precedents. So, with that being said, executive orders are not laws. They're not laws. So, we're just going to start there with it's something that is made to create fear. Yes, he did sign an executive order, but it is not a law. All right. So let's get into this executive order a little bit because there's a lot of things in this executive order that are false. Let's get into some false versus fears. The executive order creates a whole bunch of falsehoods about gender-affirming care that is not evidence-based care for transgender individuals, which we all know is false. The real fact is that gender-affirming care is recognized essential care for many transgender people, particularly for youth, and it's used to help them align their bodies with their gender identity. And it is very widely accepted by the medical community. Um, this care includes things like mental health support, hormone therapy, and a bunch of other treatments. So, getting more into the executive order, a lot of people are asking, will the executive order immediately affect access to care? Well, truth is, the executive order does suggest some drastic changes to gender affirming care. Um, But it's important to note that no immediate changes have been made. So the executive order does not immediately alter any access to care. And it's true that the order could eventually lead to policy changes. That is true. But that would also take time. Uh, that would have to go through the Department of Health and Human Services and other agencies to make that type of administrative rulemaking. So that's not even going to be implemented immediately. So the order does outline several provisions that limit and they do eliminate access to gender affirming care for people under 19. And some of those things include puberty blockers, hormone treatment, and surgeries. Um, in the executive order, it suggests that these treatments are, of course, harmful, unnecessary, but there are plenty of studies and research that shows a bunch of significant benefits for many transgender youth by gender affirming care. And not for that, puberty blockers and hormone therapy are not just used for trans youth. Puberty blockers and hormone therapy are used to treat various medical conditions in youth. One of them just happens to be gender dysphoria. And it's not like these medical providers are out here passing out puberty blockers and things like candy. they actually have to be prescribed this. They have to go through careful consultations. They consult with medical professionals, train people who these are their jobs. So all of these things are supported by the medical community. Well, another thing about this executive order is that um, it directs actions that could restrict healthcare providers who accept Medicaid, Medicare, or receive federal funding from offering gender affirming care to people under 18, even if it's paid for privately. So what this is it's creating fear that the healthcare providers will be penalized or forced to withhold essential care. That's what that's doing. The real issue here is that the order could influence certain policies or standards of care for transgender people. But what it is that medical ethics are medical ethics, and doctors are grounded in medical ethics, not in political climate. Falsely equates gender affirming care with practices like female genitalia mutilation. He implies that there's a connection and nothing, there's no connection that exists at all. This is only, again, to create fear that gender affirming care is dangerous and harmful, when in fact, it's medically approved, it's life saving, it's a life saving intervention. Oh, the attack on medical research. So, the executive order calls for data collection and reviewing of existing research on puberty blockers and other treatments. It sets out instructions that could skew the research findings to create a narrative that could minimize the benefits of gender affirming care. And honestly, numerous studies have demonstrated the positive outcomes of gender affirming care, including improved mental health, quality of life for transgender individuals. The fear that research will be suppressed or distorted is a concern because it overlooks the depth of existing peer reviewed studies and things in the medical review books that support these practices. Really, in conclusion, you know, the executive order, all it really does is generate fear to the transgender people about healthcare. Um, Again, it's not a law, and because medical professionals, again, are rooted in medical ethics. So those are some of the facts, some of the fiction that is going on with this new executive order that Trump put out. Um, follow us here at Blaque Magazine for more updates. Because this political climate is wild right now. So I'm T. Douglas, Blaque Magazine columnist. And stay tuned with us for more updates.